Hello and welcome once again to our online fertility awareness program, You and Your Fertility. This is our fertility diet series and we are already at episode 8. Today we are talking about fertility diet that can be used in managing tubal blockage. Yes, that is one of the very crucial factors for infertility, one of the causes of infertility that is very difficult to manage. But today we want to look at the management and specifically on how you can use diet to manage tubal blockage. So before we continue, we just want to talk briefly about the tubes. The fallopian tubes are two very tiny vessel-like structures that are connected to the womb and also open towards the ovaries. So they are just seated there in the pelvic attached to the womb, with each of them having an opening mouth that we call fimbriae, that are finger-like projections that are just opened there towards the ovary, waiting to collect an egg. So the function of the fallopian tube is at that end to collect eggs from the ovary and then through the tube transfer it into that particular fallopian tube where it can meet with a sperm and happily they become a baby. That is where fertilization takes place. And then after fertilization, that fertilized embryo can now find its way into the womb, implant, and voila, pregnancy has started. So from this you can tell that the fallopian tubes are very vital structures for achieving pregnancy, because like we just described, it is in those tubes that fertilization can happen, which is the meeting of the sperm cells from the man and the eggs from the woman. Every woman is born with two tubes naturally, both of them, like I said, attached to the womb. So one on the left side, one on the right side, one facing the left ovary, the other one on the right side facing the right ovary, and they just carry out their function happily. Now, the tubes can be blocked, and when they are blocked, it stands to reason that fertilization can no longer take place in those tubes. This is because the sperm cannot get to the eggs cannot get to the sperm, they cannot come together happily like we have said, and a baby cannot be formed in that process. What can cause the tubes to be blocked? Now, the tubes can be blocked at 3 points. One, proximally, that is close to the womb, just at the opening of the womb into the tubes. There can be blockage there. It can happen as a result of maybe infection or a fibroid that is jutting towards the tube, blocking it. These are common causes. Then it can also be blocked medially, that is in the middle of the tube, either of them. Also, infection can be a cause. Past surgery and adhesions can be a cause in that one as well. Then the third point it can block is at the distal end, that is close to the fimbriae, those finger-like projections that open it up towards the ovary. A blockage can also happen at that point due to adhesions, scar tissues, bands, formations, people who have some health conditions. All of these can contribute towards blockage of the tubes. Now, when tubes are blocked, there are certain symptoms that can present in the particular woman. Things like abdominal pain, chronic, consistent abdominal pain that you cannot put a finger to, you cannot put a cause to. Then there can also be lower abdominal pain that is at the pelvic line towards the sides. You have consistent pain at that region as well. There can also be vaginal discharge. In this case, probably it started from an infection. So the vaginal discharge will be present because of the infection that has caused the blockage as well. We can also have fever. Fever is also present when the cause is linked to an infection. Then finally, of course, we have the one we call dyspareunia, but that is just means pain during intercourse. So when a woman is having intercourse, she feels severe pain, deep-seated pain when she's meeting with her partner. So these are the symptoms that can be present during fallopian tube blockage, and believe me or not, fallopian tube blockage can also be asymptomatic. That is, the person doesn't feel anything, there's nothing that is seemingly wrong with the person, but the blockage can still happen. Now, aside from the symptoms, how can we know when the tubes are blocked? The tubes can be detected to be blocked mainly by an investigation that is carried out in most diagnostic centers that we call the hysterosalpingogram. Yes, the women's nightmare, the very painful test. Anytime they tell you that one where they pain, yes, they are most likely referring to the HSG. So HSG is a procedure that can be used to detect whether tubes are blocked. The procedure is that a catheter is passed into the uterus and a dye is injected into that uterus. The dye is expected to spill out from the nearest opening, which should be the fallopian tube. If it spills, then we know that the tube is open. If the dye doesn't spill, then we can say the tube is blocked. Another thing that can detect blocked tube is laparoscopy. That is a pinpoint surgery where the laparoscope, which is a video device, can be passed into the abdominal cavity and used to check into the tube to see if there is a blockage or not. Now, the good part of these investigations is that aside being diagnostic, that is to tell us that there is blockage, they can also be therapeutic. Like the HSG can be used to flush out minor blockages, things like little clots or little scars. That procedure can push them out, thereby opening the tubes. The laparoscopic surgery also, with the insertion of the laparoscope and some other equipment, can be used to probe into that tube and open it as well. So these are the two ways that you can surgically or medically repair blocked tubes. Unfortunately, some people don't like this method because they feel that it doesn't always work, which is true. The failure rate is high, and that it can also lead, especially the laparoscopic part, can also lead to scar formation, further worsening the blockage if the tube somehow scrapes or scratches the wall. That is, the laparoscope somehow scrapes or scratches the wall of the tube. It can now heal by scar formation, further causing adhesions or worsening the blockage. Or if the scar is not bad enough to cause a further blockage, it might now lead to ectopic pregnancy later in life. That is why some people don't really like that method. So you have a lot of people opting for natural therapy for blocked tubes. Hear it now that natural therapy has not been scientifically proven. That is, there is no science-based data to show that yes, it is working. But individual testimonies have surfaced where people talk about the things, products, organic products that they used, and were able to change their diagnosis from a blocked tube or blocked tubes to open tubes, and they were evidently able to conceive naturally without assistance and then get pregnant and carry the pregnancy to term and deliver. Now, alternate to natural therapy for unblocking tubes is something that doesn't have to deal with opening the tube. So we have procedures like IVF or outright surrogacy, where technological procedures are carried out to help the woman conceive by passing the tubes. Okay, so these are the things that can be done to help somebody achieve pregnancy with tubal blockage. But we want to focus on our topic for today. What foods can we use to unblock tubes naturally? Don't go anywhere. Before we focus on the foods that we can use to unblock tubes, we want to look at the possible causes. We have mentioned one, infections, and that is the leading cause of tubal blockage. But is it every kind of infection that will cause tubal blockage? No, the answer is no, of course. So there are certain organisms that can predispose to tubal blockage. This is because these organisms, having started in the vagina, can travel and find their way up to the tubes and actually cause inflammatory processes that block those tubes. What are those organisms? 3 are very specific for bacterial infections. One is Staphylococcus, unfortunately, yes, but very profuse, recurrent high growth staphylococcus can travel all the way to the tubes and cause tubal blockage. That can happen. Another organism that can be implicated is gonorrhea. Gonorrhea is very bad with causing tubal blockage because it doesn't even need so much high level or chronic repeated infections. Even one infection of gonorrhea, if not properly treated, can cause tubal blockage because of the level of inflammatory processes that the organism undergoes. It produces a lot of pus on its own. This can travel up and cake and block the tubes. It causes a lot of inflammation, so the tubes can also swell and have scar forming around them and things like that. So gonorrhea is also something that can really cause tubal blockage. The last one is chlamydia. Chlamydia is another very bad organism that can cause tubal blockage because of its inflammatory processes as well. So being able to arrest infection as quickly as possible is one of the keys to stopping tubal blockage. Early detection and treatment. Aside from bacterial organisms, fungi, high growth of fungal infection in the vaginal and reproductive tract can lead to tubal blockage as well. Other things that can cause tubal blockage are things like endometriosis, where you have endometrial tissue growing inside the tubes, causing inflammation, blocking the tubes. That can happen. We have mentioned fibroids. We said fibroids, if they grow and jut towards the tubes, they can also cause a blockage of the tubes. Then, of course, PID, which is long-standing pelvic inflammatory disease. This can also cause blockage of the tubes. Dilatation and curettage, when not properly done, can also lead to tubal blockage because this procedure can actually lead, maybe from amateurs, to poking or tampering with the tubes as well, causing scar formation, causing blockage as well. So these are the things that can actually lead to cause of fallopian tube blockage. Now to the main talk of the day. What foods can we use to prevent and possibly treat fallopian tube blockage? The first on the list is vitamin C. High level vitamin C, up to 1000 milligrams daily. Let us note that vitamin C is not stored in the body, so you need to take vitamin C every day. Vitamin C has no scientific proof of unblocking tubes, but because of the antioxidant nature and high level of anti-inflammatory properties that it has, it is believed that consuming vitamin C every day can actually help, because it can help break down the inflammatory processes in the tubes, and if that is the only cause of the blockage, can eventually lead to the tubes being open. Of course, this must be added to improving lifestyle and all of that, but vitamin C is the number one thing on the list that can help unblock tubes. Another item is turmeric. So either taking turmeric as a supplement, adding turmeric to your food, or using it in your tea can go a long way to helping to break down inflammation, scar tissues around the tubes, and lead to opening of the fallopian tube. This is because of the active ingredient in turmeric, which is curcumin, and that can help to bring about anti-inflammatory properties and then help to break down whatever might be blocking the tubes and release the blockage and cause the tubes to be patent again. Then again, we have some other herbs. We have our ginger, we have our garlic, we have our ginseng, and we have our donkwa. Yes, these are 4 herbs that have been shown by experience, again not scientifically proven, but from testimonies and from folklore stories, in the fertility community, there have been cases where people use these things and achieved opening of their tubes. And since these are organic compounds, organic foods that really don't have side effects if they are taken in their right quantities, there is no harm in giving them a try. So ginger, garlic, donkwa, and ginseng are 4 herbs that have also shown the potential to help in unblocking tubes. You can use them, add them to food directly, or make them into tea, okay, herbal teas, and drink, and it can help with blocked tubes. Other roots or plants are things like maca. Maca, we know, is a Peruvian plant that is used in the treatment of infertility. Also has some records of helping to unblock tubes. Of course, again, not scientifically proven. Then we have mugwort. Some of these things, you'll be surprised that you can find them in Nigeria, because you might be thinking already, where am I going to see these kind of things? If you ask properly, if you go to organic stores and check, you will be surprised that you can find this thing. Maca, I know you can find. Donkwa, I'm sure you can find. Of course, we already know our ginger, our garlic, our turmeric. These are things that if you search for them and use them, you might be able to find them, and then there's no harm in trying them. So as you have seen, the bulk of what we have mentioned are basically herbs and plants. The actual foods are not there, but we encourage anybody who is trying to improve fertility in any aspect, in this case blockage of tubes, to improve their lifestyle. Exercise, eat the right things. You have said so much about the right things to eat. Avoid the wrong things, things like trans fat, fatty, high fat dairy, soy, and all those things that we have said are not good. Gluten, they are not good for fertility. Avoid them. Improve your lifestyle, sleep properly, avoid stress, meditate. All these help to relax the system, reverse inflammatory processes, release endorphins, all of them together working towards improving your fertility. Now, other practices that don't involve foods that people say can help with opening blocked tubes are things like fertility massages. You know, that deep pelvic massage that is used. You use warm oils, warm massage oils to massage the pelvic region. It can help. Application of castor oil around the pelvic region has also been shown to help improve the situation. No scientific proof, of course, of opening tubes, okay? Then also things like herbal tampons that are applied directly into the vagina. There are many products that claim opening of tubes using this. There are some that we have actually used and have given us some good results for treating fertility issues. So herbal tampons are available, herbal pads are available that can actually help the situation. They work. There are cases, of course, not scientifically documented, but they have been shown to give results and are worth the try. Finally, this one is basically argued by a lot of people that it doesn't have much benefit, but it really doesn't have any negative effects to it as well, and it is vaginal steaming, okay, or the seeds baths, sitting in over steam or warm water, you know, not the one that will cause scalding or burns, but the one that can help in soothing the area. Some people claim that it helps with unblocking tubes as well. Some people argue that how will the steam get to the tubes? It's such a far distance for it and might not be able to do much. However, it doesn't have any medical contraindication and can also be tried. Doing all these things together, like we have mentioned, and seeking medical care, be it through laparoscopic surgery or flushing with the HSG, can all together bring about improved results. So why not give it a try? We hope you have learned something. Remember, this program is brought to you by Love Foundation, a fertility support organization, which is a one-stop shop for everything fertility, from counseling to education to advocacy to treatment support to consultancy on advanced fertility options like surrogacy, adoption, ART treatments like IVF, IUI, ICSI. Whatever your fertility needs are, you can be sure that we can help you with it. Until we come your way again next week with another interesting fertility diet solution to a fertility problem. Remember, learn to teach others. Thank you for staying with us. You can follow us on all our social media handles on Facebook, Instagram at Love Foundation, YouTube Love Foundation, where you can watch videos like this and more. You can join our support group on WhatsApp. You can inbox us and we'll give you the link. Thank you for staying with us. See you again next week. Bye-bye.